Hello, and welcome back to another episode of Unique Moments, where we take a moment to breathe, take a moment to pause, reconnecting mind, body, and spirit. And on today's episode, we have a very special guest, Peter Stuart, who is a massage therapist. And we're going to get into the body. I am going to read his bio, but first, I wanted to pick a card. I got these cute little mindfulness cards, and you like pop them open to see what the message says. Ooh, this was a quote by Mary Ann Williamson. I love her as an author. It says, "Inner peace doesn't come from getting what we want, but from remembering who we are." I like that. I like that. I like that. We think if we get this thing, if we do this thing, if we do the accomplishment, if we get to where we want to be, we'll have peace. And this is the whole reconnecting and remembering. Why I created this podcast is like, when you remember who you are at your core, before you wanted things, before you desired things, before you had things to lose, before you had attachments, it's like you at your core, your essence, your inner being is peaceful. It's peaceful. It's the closest to God. It's the closest to spirit. It's the closest to source, and is perfect for this episode because me and Peter, we talk about his work with his patients and doing massages, and his work with myofascial release therapy and light touch therapy. And we also get into just fitness and health and the body. And it's like, when you remember who you are at your core, like this divine human being, there should be peace there. There will be peace there. Or I get peace from that, because it's like, outside of all the noise, outside of all the hustle and bustle and the day to day and the age of the internet and whatever, it's like inner peace. Inner peace. It doesn't come from what you do. It doesn't come from what you have. It's who you are. It's who you are. Okay. I'm going to read, so bear with me. Introducing Peter. So Peter graduated from the Canadian College of Massage Hydrotherapy in 1993 and has since dedicated his career to helping people overcome chronic pain. With over 30,000 hours of clinical experience, his work focuses primarily on a light touch, intuitive approach to myofascial release. Early in his career, while working with Dr. Stuart Donaldson, Ph.D. at Myosymmetries, a chronic pain research treatment facility in Calgary, Peter discovered the profound effectiveness of gentle myofascial techniques. This experience reshaped his understanding of pain and healing, inspiring a lifelong pursuit of knowledge about fascia and whole person therapy. Drawing from decades of study with leading researchers and mentors, Peter developed an integrative approach that addresses not only physical dysfunction, but the emotional and energetic dimensions of pain. His own experiences of recovery and healing have deepened his empathy and connection with those he treats. For over 30 years, Peter has been an educator teaching anatomy, physiology, and myofascial release. He believes education is central to healing for the practitioners and patients alike. By helping patients understand their bodies and actively participate in their recovery, Peter empowers them to achieve meaningful, lasting change. Throughout his heart-centered approach, Peter continues to bring hope and transformation to those who believed they had reached the limits of healing, and remains deeply grateful for the inspiration his patients provide. Wow. So this man has been doing his work longer than I've been alive, so much respect. And without further ado, let's get into the episode. Hello, and we are welcoming Peter Stuart to this episode of Unique Moments, where we are taking a moment to talk about his work and what he does and how he helps to heal people. So, if Peter, you want to just tell people who you are, maybe what you do, if they've never heard of you before.
Sure. Hi, and thanks for having me. My name is Peter Stuart, as you know. I'm a massage therapist of 32 years, and for the past 27 years, I've been focusing specifically on a treatment called light touch myofascial release. And I work mainly with people who have chronic issues, chronic pain, multiple trauma issues, etc.
Okay. And what made you want to switch to just doing the massage therapy into the myofascial release? How did you get into that?
Okay, yeah, well, that's a bit of a story. I got into massage simply because I was an athlete at one point, and my knees just kept getting worse, and I could not find anybody who could help me with that. So I basically ended up having to leave my sport. I was no longer able to play it at the level that I was once playing it. And I thought, well, you know what? I had a couple friends who were doing the massage therapy program. So after chatting with them, I thought, well, maybe I'll help athletes, and start off with massage and see where it leads me. But 5 years into that, I was working with some athletes, amateur and professional, and that was all great. It's just very hard on the hands, and that's a lot more tissue to push around
Mm.
than your average person. And I was working I have my own private clinic, but I was also working at a place called Myosymmetries, Calgary, which is a chronic pain and research facility. I was working there part time and started to see people coming into my practice that were chronic people. People who had been, post motor vehicle accident, say 2, 3 years, and kind of plateauing and getting passed around. And what I ended up doing was, having that breaking point, that moment where I thought, I've got to do something different
Yeah.
because, it's not making a change. So I had this lady coming in. She was, I think, 3 years after her motor vehicle, and I wasn't getting anywhere. And she was content just to keep going. She just thought, oh, well, I think we just need to throw more at this. And I was like, not convinced about that. So she came in one day and I just, basically gave her, the best possible massage I could give her, everything I knew to do.
Your
And,
job. Yeah.
right. And then, she got off the table and she was like, wow, I feel really good, actually. I can move better. And I was like, okay, there we go. And then she came back a couple days later and I had to go fishing for, hey, how was that massage you had the other day? You know, full ego on display. But I was like saying, listen, um, she had her sort of, list of the pains and aches that she had been experiencing over the past couple days, and I just said, "So, what was it like after your treatment?" And she said, "Well, thinking about it, she just said that was actually amazing. I loved it." And I said, "Okay, well, that's great." She said, "Yeah, I could move better and I felt better." And then she said, "Right up until about supper time."
Hmm.
And then it all came crashing back, and I was like, put my, basically energetically put my hands over my face and went, ugh, what am I supposed to do with this? So between her and the fact that I was having a psychological aversion to having oil on my hands all the time, I was constantly wiping them off,
Yeah.
and then that, and I was getting sore. My hands were getting sore doing these techniques. So that was the catalyst for me to go, okay, I got to find something different.
Something
And
different.
yeah, I got introduced to this from a physiotherapist friend of mine, and just went down to the States and started taking as many courses as I could, and then ended up being an instructor in it. And, here I am 27 years later. This is the stuff, this is the technique that we were using at the chronic pain clinic that was so effective for treating this particular group of patients. So I've had great success in it since.
That's interesting. And specifically, what I'm wondering, because I think my brain, it goes, because you talked about it's like light touch. And so normally I would think, okay, if you have either a deep rooted issue or maybe deep rooted pain or chronic pain that you've been having for a while, you would think, you have to really get in there, and like the tougher that you
Mm.
work on the muscles, work on the fascia, work on the skin, then it's releasing more. So, can you explain a bit about like how that works when you're using like the light touch versus, I guess, what you would normally do, and why that seems
Yeah,
to work better for patients who have chronic pain?
yeah, sure. So one of the things Dr. Stu Donaldson, um, the owner and operator of Myosymmetries Calgary, um, did was he kept statistics on everything, and he was very, very particular about his approaches to working with this group. One of the things that he found in his studies was that aggressive techniques tended to flare the nervous system. And if you flare the nervous system on somebody who has the symptoms of somebody who has chronic pain, then it'll take less stimuli for them to flare again. And it's certainly not a place they want to be when their symptoms are flaring. So, to be honest with you, we were just doing the this light touch. We did massage and a few other things there as well, but it was the light touch myofascial that seemed to make a change in the nervous system, where traditional therapies like chirophysio and massage didn't seem to have the same effect. So that's how that's how we got into working with chronic pain and light touch. Yeah, so we tend to stay away from the aggressive techniques.
Yeah, and that makes sense. The harder you push, the more it would be inflamed and irritated, or kind of, I would think. But you spoke about, you said the nervous system, and I'm a big fan of nervous system, subconscious work, and then just putting the whole mind, body, spirit piece together because it all
Hmm.
does really work together.
Hmm.
So can you speak about how maybe, and I don't know if you've had like a specific client or patient, or if they've had like maybe some connections that you've noticed between like um, something going on emotionally and versus something going on in the body? Like, do you always think it's like, because you're handling the physical piece, you're doing the massage, you're doing the light touch, but do you think it requires more than that? You know what I mean? Versus like even when you were having the conversation with the lady with the massage who felt better up until dinner time, it's like you're asking her and you're going through, okay, name the emotions. How did you feel after this? What did this do? Versus people will just get a massage and be like, I feel better. And then in a month or two, you need another massage. Like, do you think there's a link between addressing certain emotions versus the amount of pain relief that you can get?
I would say overall, I am, when somebody comes in to see me for an assessment, I am treating the entire being. I am not treating your shoulder injury or your neck injury. Um, this is so people tend to get into a chronic state because there's an accumulation of trauma over time. And that trauma is not just physical, it's mental and emotional stress too. And who doesn't have mental and emotional stress if you have a physical trauma,
Yeah.
right? Nobody nobody breaks their legs skiing and thinks, "Oh, that's fine," right? I think we're all upset by that,
Yeah.
and and if there's any transgression done to you, it leaves a mark, right? So people's trauma can come from a lot of different places, and Dr. Peter Levine, Dr. Bessel van der Kolk, there's a whole bunch of these amazing beings out there who have been studying that mind-body connection, and it has to do with the fact that and Peter Levine said this years ago, that there's an imprint in the tissue from the nervous system of traumatic events, and what affects one person may not affect another person, right?
Yeah.
So it's unique to the individual. So when you show up in my office, I'm treating the history of everything that's traumatized you. It's not just about getting your shoulder injury better, and that may be what what's foremost on your mind, but I need to ask a series of questions in order to understand what your past traumas have been and have you dealt with them. Because a lot of times when people are chronic, what we find or what we have found was that they have not, there's a reason why the trauma or sorry, the pain proliferates. And
Hmm.
it's usually because nobody's looked at the other things that have happened to them in their life. The neck injury can be passed around and around and around. But if we don't look at that person as a whole human being and address who they are as a person, mentally, emotionally, physically, as a therapist, then then we will tend to miss things.
Hmm.
And it's not like people aren't doing good work. They know they're doing the work they know to do. I believe most therapists are really dedicated to what they do. But if their skill set doesn't include the understanding of how trauma can accumulate and that it's not just physical trauma, then it tends to be that these people um, will continue through the system to try to get better through traditional means
Yeah.
when certain things that need to be identified and worked on aren't. I'm not the be all and end all of anybody's healthcare. The work that I do is excellent, and I do there is an emotional component to the work that I do as well. However, if you need to work with, you know, a psychologist or a psychotherapist or somebody about a trauma that you had when you were a kid, then you may need to do that before you come and see me, right? Um, uh, and maybe you have extreme nutritional deficits, and you
A
need
big
somebody
one.
to help you with support with that, right? Maybe it's medication because, if you're not sleeping and you've done your CBD and melatonin and all the rest of the things and you're still not getting sleep, then you need medical intervention.
Yeah.
And we need to swallow our pride. I don't know what it is nowadays. Like when I first started doing this work all those years ago, we were working with doctors to try to get people off their medications because they were
Yeah.
on, 14, 15 different types. Now nobody wants a medication. And it's like, well, if you're not sleeping and no other aids are helping you, I'm sorry, you have
There
to
is
go back to
something
your
missing.
doctor and make it happen. Or they deal with pain. Oh, I'm just dealing with it. Really?
Yeah. And I think that's a big, large majority. I don't know the statistics, but I feel like a lot of people are just quite literally dealing with a lot of pain, physical and mental and emotional, and they're not really
Well, I
addressing.
think oh, absolutely. And I think the opioid crisis is, we threw the baby out with the bathwater.
Yeah.
Now nobody wants to take meds, and it doesn't have to be opioids. There are all kinds of ways to get medication to help your pain, and it doesn't have to be, a harder pharmaceutical on the system. So, and everybody's chemically different. You
Hmm.
need to work with your doctor and pharmacist to find out what best helps you because if you're just walking around in pain constantly, then you're reinforcing that in the nervous system and you're overtaxing the system and you're going to get really stuck in
Yeah.
that
That
place.
becomes your new normal in a way.
Well, and that's what we were talking about with the brain and the nervous system earlier. What I do is, yes, I do release the tension in the body through the fascial system and how that binds down on the body. But when when I can make those changes, we're also doing brain entrainment. We're allowing the brain to see, oh, I can actually drop into this new place and establish new neural pathways for that place. And as we do this time and again, because I say slow and steady wins the race, slow
Hmm.
and steady creates permanent change in the brain. Fast, quick changes don't tend to hold. So it's a matter of sticking with it and allowing your brain to slowly change who it thinks you are and how it wants to hold you.
Hmm.
So yeah, that's a loaded question. There was a
Yeah. No, that was
there's
a
a
really good
lot to
answer.
it.
I'm curious though, and maybe just in your personal opinion or things that
Mm.
you've learned, do you think it can work the opposite way? Like you spoke about how, someone may need to go see a psychotherapist or a psychologist. So, say maybe I have some pain, maybe I have like chronic neck pain, but it doesn't bother me, but I just know my neck shouldn't be hurting like this. And I also know that I have trauma. Do you think if someone, does their own work and goes to therapy and does the healing and, gets help emotionally and mentally, do you think that makes their physical symptoms go away? Or do you think they need to
I,
be treated individually?
yeah, individually for sure, but I don't think it makes it go away. If you have physical damage, you have physical damage, and there will be changes in which the nervous system's going to set up, and there will be patterns of fascial tension as a result. But when somebody works through their mental and emotional trauma with a good therapist, what tends to happen is that there's not this chronic signal in the brain telling it that it's being traumatized. Like there's constant signal from your neck pain, and it's saying, I'm not really interested in any of the body work that you're doing
Yeah.
because I can't make a change because I'm kind of stuck in this place. So helping you with your mental emotional traumas will help you get, for lack of a better term, more unstuck and
Hmm.
allow the nervous system to shift and make change again. So absolutely, they go hand in hand for sure. Yeah.
Yeah.
And you would need the help afterwards because you have a fascial pattern of tension set up that needs to be released.
Yeah. Yeah.
There's so many compensatory factors that are involved with that.
Okay. And then, do you think, like your work, is this beneficial for people who maybe haven't gone through any trauma and they just maybe have pain in their body, like I've been in an accident, or I have
Oh man.
poor, like you said, poor eating habits or poor exercise habits, and I'm just in pain. Like, is this something that they would go to, or do they just need a massage?
We're so North America is so set up to put a band-aid on something that hurts, right?
Everything.
And right, and it's kind of like, well, I don't have to see just chronic pain. You can come and see me if you're not in pain.
Hmm.
One of the things that I do, I mean, I still work with athletes, especially sprinters. So one of the things that I look at is enhancing the athlete and their better to have a better outcome, to have a better physical. Uh, how should I put it? To gain more power and speed. Um, and that usually comes from this work that I do called pelvic rebalancing. So I wrote a whole course on it because over my years of looking at people, I found that um, their pelvis, if it's out of balance, then there are a lot of compensatory changes that happen in and around the glutes and the thigh muscles, the abdomen, the low back. And that translates all the way up to the head, neck, and jaw.
Mm.
And it effectively, I mean, if you've got one pelvis bone higher than the other, then you have one leg longer and one leg shorter. And the compensation that happens is tremendous. But if you can get back into balance, you should be able to gain more speed and power and be less susceptible to injuries. I can't believe how many people I see with knee injuries or hamstring tears and et cetera, where I don't think it needed to be if they were imbalanced to begin with, and then were strengthened in that place
Hmm.
instead of strengthening in the imbalance and then creating an even bigger imbalance. So.
Yeah. Do you think there's, and kind of borrowing more from Eastern philosophy, like, do you think there's certain stretches or poses, or maybe you can recommend, or not poses, but like movements or maybe mindful things that people can be mindful of in their everyday life that kind of can help them not get so out of balance?
Sure. I mean, I think yoga is great, especially holding for longer periods. That's what I have my patients do. I don't call it yoga, I just call it fascial stretching. But,
Yeah.
you know,
People have a
I,
weird association with terms like yoga and stuff. Yeah.
right? So what I ask people to do is stretch for 2 minutes at in any one area that we're targeting, and if they can go beyond that, great. Don't stretch into pain. There's a lot of there's a lot of injuries in yoga,
Hmm. Trying to get to
and
that
that's
edge. Yeah.
yeah, right. And it's just because you feel competitive, you haven't been there before. The teacher doesn't know how to modify the exercise for your particular physical situation, that sort of thing. And but it's more on that yoga. Samara, I find it interesting that we are an animal that made up of muscle, and every other animal in the animal kingdom stretches on a daily,
Naturally.
regular, naturally, and we don't.
Yeah.
You know? and,
I'm
and
big, big, big on stretching. Even if I'm tired at the end of the day, I will like make time to stretch because one, it feels good to my muscles, and two, I just know
Mhm.
I'm doing a good thing for my body. And as you're getting older, and maybe you're more mobile, maybe you're less mobile, maybe you're active, maybe you're not, but it's just so good. And I don't know why we don't stretch more.
I don't know why either. It fascinates me that this hasn't been part of our culture. And I, when I'm in a gym, and I do think that we need to strengthen. I think weight strengthening is really important.
Of course.
Um, and because we're not all built to be runners, I'll tell you that. And not everybody works well with cardio. It can create inflammation for some people, right?
Yeah.
So, but even low weight, high reps is proven to be extremely um, physiologically healthy for us to do. But it's the stretching after you have an activity, that static stretching, that nobody does. And, I kind of walk,
Mhm.
I used to joke that, I kind of walk around the weight room and back in the day, and I want to just slip my card in every now and then to somebody who's doing an exercise that I think, wow, you need some
I
guidance
need
on this,
it.
and
Yeah.
how you're doing it. And I see that you don't stretch at all afterwards, and you pound your hamstrings. So,
And it's like, I
yikes.
know you're sore, so what are you doing? And it's going back to the what you said, not slow and steady wins the race, but these longer term things that you have in place. Like, yes, lifting the weights and eating the
Mhm.
protein and doing all the things that's going to build the muscles, but to actually care for your body and all this pressure that you're putting on it and ripping apart the muscle fibers, like you need to take care of it after and not
Yeah.
just once a week. I have so many people that I know that don't stretch before or after you work out. And it's like, how long before, that's going to cause a problem?
Well, and if you look at it physiologically, I mean, we microtear our tissue, our muscles when we are working out, right? And so the muscle can grow and eventually become a bigger muscle group. But that repairing gets done by scar tissue, right? So you have these adhesions all over the place that are slowly restricting your range of motion.
Mhm.
Because if you don't stretch and break those scar tissue adhesions up after you're done, then they proliferate, right? And then you're getting tighter. And even physiologically speaking, from again from that power and component, that idea, when you have muscle filaments, they slightly overlap each other, right? And then when you contract, they they come together.
Mhm.
But if they're already partially contracted because you're so tight, then how much power can you gain from that muscle? If it was well stretched out, you would get more power from it. Is
Yeah.
so the idea of not stretching, I don't know, it baffles me. But one of the things I'm working on right now is trying to change the way personal trainers are trained.
Mm.
And I'd like to, well, I'm in the process with my wife to create a 1 year program so they know their anatomy, physiology, and pathology and can read a body and assess it. And when they're interviewing somebody, understand what their limitations are and create realistic goals for people. Too many people go to personal trainers and it's about gains and it's about,
Yeah.
but you know what? You have to work within the balance of what that body's able to give you. And so many people burn out from that experience, and it's discouraging, and it's tough on the brain, you
Yeah.
know? Y-
Yeah,
y-
especially working out. It's a lot mental too. So what do you think they're missing? I know you said you're working on a program. Like, do you think they're missing more of an initial assessment with their clients, or do you think they're just not educated about, I guess, specifically what needs to work for certain people? Like, what do you think is missing in that personal trainer uh
Well,
area?
I think personal trainers tend to have like there's such a wide variety of them, in their understanding of the human body. And what I would love to make is a standard program. So when a personal trainer gets out there, it's important for that older person who, doesn't, braving going to the gym for the very first time, to be to be seen for their deficiencies and imbalances, and created, and then having a program created for them that will work to their advantage, and get those gains and whatnot. Now, don't get me wrong, there are great personal trainers out there, but I think in general, the idea is you need to see these people for who they are. And I think that comes in the assessment. So you need
Mhm.
to know your anatomy and your physiology, in depth, and then the pathologies. What are you looking at? Why is that shoulder doing that?
Yeah.
You know, do we just throw weights at that, or is there something more nefarious going on that you need to be able to pick up so you can refer out?
Yeah.
You know, so yeah, I know too many people who have unfortunately had to quit because they were, kind of hurt by the experience,
Mm.
physically, from doing their workouts. So
Like too
yeah,
intense.
yes,
Mm.
more often too intense, or targeting the wrong areas.
Yeah, I think that's the
Right.
thing in targeting the wrong areas and finding a good personal trainer because there's so many exercises that you can do that target the same muscle groups, but it's like, how do you know this is the one? Or because I had a personal trainer for a while and I did see a lot of results, but I think there comes a point where it's like, okay, I have this idea of what I want to look like and my goals, and then it's like realistically what do I have to do to get there? You know, not just this is what women do to build a nice bottom, or this is what men do to build a nice, you know what I mean? It's like, okay, what do
Mhm.
I need to do to get the figure in shape that not maybe that just looks good, but that's healthy for my body, you know? Because I've been to where I was running 3 miles a day. Did I love it? No. Did I see changes in my body? Yes. Was it the best for my body? I don't know. I don't know what was going on inside. I just know I like the result of that, but that wasn't sustainable for me. So I think it's like finding, again, like you said, what works for you and what works for your body kind of thing.
No, really important to note that too. And it's like, what are your goals going in? Do I want to sculpt myself in a certain way? Do I like uh, people? Or sorry, personal trainers really need to understand the intention of their client, and then help scope that and say, that may be an unrealistic goal for you right now. Let's try to start with this and that, and let's just see how things work. And we'll modify as we need to, but here's where the deficits are. Here's where I see you would gain so much better balance and strength. And so I think if we stick to this program, you know, just yeah.
Yeah.
How
And
many
people don't
people
want
have
to
been
do
out
that
there
work.
running? And we've all been runners at one point, I
Yeah.
think, right?
Yeah.
So, yeah.
And I like running. I love moving my body, but it's just like, again, with the listening to your body, and that's the mind and the body connection. It's like intuitively, sometimes like I want to go on a jog, but like my body is telling me you need to go on a walk today. And it's like, okay, if I'm not
Mhm.
tuned in enough, I could miss that whole cue and just do what I want or go jump rope or go work out when it's like, no, I don't need to know why my body's telling me I need to walk and not run today. I just need to listen and then like see how it feels. And I think missing from, yes, the personal trainer, but also the person itself, it's like, okay, assessing, like, yes, I think um progress pictures are helpful and tracking your progress, but I think checking in with yourself and assessing, okay, how do I feel? Do I feel better? Do I look better? Like what is, what's going on? So I think that component is missing, just the kind of checking in with self and connecting, okay, this is my goal, this is what I want to do, and this is how I feel about it. I think we're missing the feeling piece in a lot of it.
Well, and Samara, I did this a year and a half ago. I was at a gym and I was training, and I really wanted to go slow and build up with lower weights, because I've been talking to a colleague about how inflammation can be created from excessive weight, if it's not for your body type. And I'm strong, so I was on this program, and I just kept getting bigger and stronger, and I forgot all about checking in with myself,
Hmm.
right? And I've been doing this for so long, and I knew better because I went in with the intention of not doing that, and I did it anyway,
Yeah.
right? And then my elbow blew up on me. I had some rib inflammation, and then my left knee, and all within a month.
Yeah.
And I thought, okay, that's it. It's time for a reset. Now, I think there's a nutritional factor for me as well. I need to be eating healthier. Well, I shouldn't say healthier. I eat pretty healthy. It's a matter of not eating the foods that create the inflammation
Hmm.
that as well, right? Like you have to look at a person as a very well-rounded, in a very well-rounded way.
A
So
whole person. Yeah.
yeah, yeah. So, yeah, to the year program, there would be a definitely nutritional component as well, and then that's outside of learning how to physically train people. But yeah, it's a matter of really, like I have a lot of respect for personal training. I've got a great personal trainer. She's young too. I mean, and she can see me differently than every other personal trainer I've been with.
Mm.
And I just, I think I'm so grateful that, she and I met up. And it's a tiny tweak here, a tiny tweak there that takes, oh, that's all I needed just to create a pain-free situation
Yeah.
and be more stable in my body. And you need people looking at you, especially as you age, right? So, and you have these imbalances. It'd be nice for people to point out those imbalances and say, hey, you need to get your pelvis balanced.
Exactly. Exactly. Now, in your experience with the so like we're still talking about pain, right? Like you were saying if you have an injury and you're working out or even taking it off of working out just in general, do you think that is a signal to kind of stop and rest, or is there some sort of like nuance there to where it's like, okay, I'm feeling pain because I did a hard workout, or I'm feeling pain because maybe I'm feeling this other way. Is it okay to push through it? Does that increase inflammation, or should you always kind of, like take a beat whenever you feel an area of your body either inflamed or in pain?
Inflamed or in pain are red flags,
Okay.
right? To working out, you need to have pain-free range of motion in order to gain benefit from working out. But I mean, it really depends on who you are. It depends on the population, and that's again where I'd love to see personal trainers understand, separate the athlete from the elderly, and
Hmm.
everything in between, because we're also unique, and be able to assess the individual for what their imbalances are and how to create a balance in their body again through a unique program that is that individual. So yeah,
Yeah, I would love to see that.
yeah.
So especially now, I think working out has always been very popular, but I think there's been a recent increase in gym culture and just gains and, kind of just elevating being your best self, living your best life, and what comes with that. And I think there are, sacrifices that you have to make. But I was just curious, at what point is it kind of like, okay, just because I'm slowing down doesn't mean I'm weak or incapable or, so I think, again, it's like how you talk to yourself.
Well, yeah, and if you're new to the game, then you really want somebody to hold your hand through it. But having that intuitive side to you, and really understanding what what information is being fed to you, that you're picking up on, that's really important to note, right? And when you can push through and when it's not safe to push through.
Mm-hmm.
And it's funny, in the aging population, they say we're getting drier and drier as we age, right?
Mm-hmm.
Like over 40, we're drying up to some extent. We heal more poorly. It
Yeah.
takes a lot longer, et cetera, et cetera. The aging process can be kind of brutal, but I've seen too many. All of these are men clients, but I've seen too many who have torn muscle tissue, avulsed tendons from their bone, etc., by going after bigger and bigger gains
Mm-hmm.
in their 40s and even in their 50s. They've set themselves up for some, um, unnecessary injury. Nobody wants surgery at, at any time.
Yeah. Yeah.
You know,
Yeah.
nobody wants that intervention if you don't need it. And then you have to ask yourself why. Why do you need those gains? Like, what
Back to
is
the
your
mind.
intention?
What is it exactly? What is your intention? What is it doing for you? What is that? Why do you need this? And that's a big question to ask. I agree.
Yeah, no, it's front and center, and it's what I ask my patients too. What's your intention for coming? I want to know what your goals are and how they're going to fit in with what I see in your body. You want to be 100% where you were 20 years ago. That may not be something that we can achieve.
Yeah.
You know, Maybe it's 80%. And most people would take that and
Yeah.
say that would be a lot way better than where I'm at right now. So yeah,
Yeah.
it has to be based on the individual and and the proper assessment to figure that out.
So, what would you say, and maybe this is a more nuanced question, but what would you say to someone who maybe they want to start feeling some relief. Maybe they can't do a myofascial release massage. Maybe they can't do any massage and they want to start working out. Like, where do you think maybe they don't have a trainer to hold their hand through that, you know? Like, do you start with the nutrition and eating less inflammatory foods, or do you start with maybe just light stretching, gentle movement? Like, someone who's maybe very sedentary and like doesn't move their body that much, like, where do you think is a good place for them to start, just to kind of start tuning into their body and, kind of what's going on?
So I would say two things. From the nutritional standpoint, we have to tune in and after we've eaten something, check in with yourself. Did that make you feel full? Or do you feel energized after you eat? Do you feel light and because sometimes it's the amount you eat in a sitting, but sometimes it's did you just eat three slices of sourdough because it's delicious and you slathered it with peanut butter, but now you feel kind of bloated,
Hmm.
right? Check in with that. But isn't it lovely to eat something that isn't that? Maybe you eat an apple and some almonds, and you feel sort of full, but also a little bit more energetic, right? Start to use your basics and just tune into what foods work for you, and what foods start to understand what foods are probably working against you
Hmm.
toward your goal. And then I would say walking.
Yeah.
And just get out and walk and be mindful about it. Check in with yourself, see how your body moves. Be grateful that you're ambulatory, right? And that you're not in pain. And breathe in the air and take in the sunshine or the rain or whatever it is. If you're out with your dog, how lucky is that, Just you know, just movement
Yeah.
and being aware and being grateful for your ability to move because it it's a gift and it doesn't always stick around,
You never know.
right?
I was
You
having
you don't.
Yeah, I was having a huge just moment of gratitude yesterday, and I think I was watching a
Mm.
TV show, and it was something medical was going on, or something in general, and I was just reflecting, and I was like, wow, like, I've never had to have a major surgery, and like, I have all my limbs, and I have, and I was just going on this thing of gratitude, and
Mm.
I get to go out and take a walk or breathe fresh air. And so I love that you mentioned that, because it's just so important, and I think it's little that people forget, and it's like that can change your whole perspective. That can change your whole day. Just being grateful for the fact that you get to move your body. You're not wheelchair bound, or you have all
Mhm.
your senses, that you can see the trees outside or whatever you have surrounding you in your environment. So I really love that you mentioned that, because I think that's a great place to start. And I'm a big, big, big fan of walking. I think that's some of the best exercise you can do that's free. So
Yep. And you can choose where you walk. You can walk in some of the most beautiful places on earth, right? You walk through the woods, smell the trees, smell those leaves on the ground, smell everything about it. It's all those, let your senses take it all in because it's very meditative and calming to the mind. I mean, even my medical doctor said to me years ago, like, if you're going to go for walks, why don't you just go in the woods? That's your happy place.
so much
And I said, it's
oxygen
true.
too. Yeah.
Yeah, yeah. And yeah, just you start to pick and choose where you want to actually do that walk, and it's lovely,
Mhm.
right? Yeah, 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 and it's so good for the mind
Yeah,
as well as the body.
I agree. Well, Peter, do you have anything else that you want to leave the people with? Want to share maybe where to find you or where they can learn more about you? I am going to link his website in the description below as well.
Yeah, so I've basically an educator as well as a therapist. So I've written up 6 new courses over the past 2 years on really honing in on how this light touch myofascial release can affect change in specifically in your patients. So and then how to assess and things like that. So. Um, I love to. I'd love to be. I love teaching. I love being able to pass this on to people and to therapists and of all ilk. You don't have to be massage. I've taught therapists of all kinds, and it's and passing along any wisdom. I would say, from a fascial standpoint, you got to move. Sedentary lifestyle is the enemy of the body.
Mm.
It creates fascial stiffness, which creates patterns of tension, which hook up with other patterns that you have, maybe because you are a desk jockey or, whatever your postures are. And that hooks up with the trauma that you had from a car accident or when you were a kid and, that sports injury. And all of a sudden you're getting shrink wrapped, right? Over time.
Yeah,
So move and stretch and drink lots of water and eat healthy.
good deal. Well, thank you so much, Peter. I really enjoyed having you on today. This was a treat, and I thank you so much for being a guest.
Oh, well, thanks very much for having me, Smile. It was fantastic.
Cool. And until next time.
Okay, sounds good. Cheers.